So here we are on week 10 of the Clinical Gait Analysis programme. I'm Dr. Steve Priest and I'll be giving this session and the following session, both of which will focus on EMG. In the first session I'll be discussing the theory behind EMG signal generation, and we'll also cover a range of issues which relate to EMG signal quality. EMG signals are generated when a signal sent along a motor axon to an individual motor unit creates a change in the chemistry of a muscle. Specifically, there is a localized depolarization within the muscle, and this sets off a travelling wave known as a motor unit activation potential. Large numbers of these waves travel along the muscle belly and ultimately combine to produce the observed EMG signal. In the first part of the session, we'll learn a lot more about the physiology of the EMG signal. We'll also learn how an EMG system works and how it's able to record the characteristics of the signal as it travels along the muscle belly. In addition, we'll focus on physiological factors which can influence EMG signal characteristics and the different types of EMG systems which can be used in clinical gait analysis labs. In the second part of the session, we'll focus on the different factors which can influence EMG signal quality. We'll also learn how to recognise artifact within the EMG signal which has resulted from an error in the way the data was collected. Being able to identify poor quality signals is an essential skill which needs to be developed by anyone working in clinical gait analysis. We'll look at factors such as where to place the electrode, how to reduce crosstalk between different muscles, and how to prepare the skin. At the end of this session, you should have developed a solid grounding in the underlying theory behind EMG. You should also have a clear understanding of all the factors which need to be considered when collecting EMG data, and also be able to recognise poor quality data before it's too late.